we've done a lot of work to encourage cross-pollination, to encourage speaking to each other, to encourage engaging with each other. But I want you to step back and step away from just your solution and look at the solutions that your colleagues are presenting. The way that we work, we have always thought holistically. And what we are trying to encourage actually is that everybody should be thinking holistically.
Nigeria Health Watch, we commenced the engagement with MSD for mothers since 2018. The questions that we have tried to address are around the high maternal mortality rate, the significant gaps in access to quality maternal care, and the disparities in maternal health services due to poor financing.
Current project, which is the PACS project, building up from the integrity. These providers, PPMVs, largely said that there are a number of things that they required. They talked about access to finance for their business, linkage to sources of quality commodities, and some sort of branding. How do you distinguish an accredited provider from a non-accredited provider, because they are in the same community?
The 4-month project, really our goal and intended impact was to reduce the maternal mortality, to improve the quality of maternal care, and ultimately to strengthen systems for safer childbirth. And so we identified 3 key states, Delta, Kano, and Lagos. The maternal mortality rate in Nigeria is really high. 20% of the global maternal mortality is from Nigeria alone. And so we thought, how can we begin to address this? In the 3 states of focus, Lagos, Kano, and Delta, what we found was that there were systemic gaps, whether it was in terms of shortage of healthcare workers, in the commodities, in the infrastructure, and that ultimately undermines the quality of care that is offered.
Just enough to empower women. It's not just enough to tell them they need to go to the facility or teach them about real risk factors. It's important to also link them to a quality facility that can actually provide the services that they need. And so we created Digital Moms Project, right? And Digital Moms Project is leveraging MDoc's virtual and in-person support to enhance women's physical, emotional, and financial well-being.
What can I do differently to improve the quality of care I'm providing? There's variability in the quality of care. I go to facility A, I get similarly good quality of care. I go to facility B, the quality of care is really, really terrible. How can we standardize care around this? And that's why we've introduced QI, quality improvement. I think for us is let the providers be involved in reducing the kind of care they're providing. First, let them understand, do you think there's a problem? By the time we did a lot of assessment, engagement, they realized that yes, we could do better. Now you know there's a problem. How do you address this problem? And then we'll build their capacity using QI as our approach to make sure that they're able to address the care.
We're really trying to push the focus to what the patient needs and really trying to connect the patients, the payers, and the providers. So it consists of a set of interventions which really starts with financial cover, which Lashma is providing, and digital tools, which is something Farm Access would provide. We also have our quality improvement tool, which is SafeCare.
With all the discussions we've had, the programs we've had, it behoves on us too to use our voices outside of the work, beyond the work, just in our everyday lives, to really spotlight this issue. That, you know, as a country, there is no reason why we continue to have the high levels of maternal deaths. It just doesn't seem right. There's nothing that we as, Nigerian mothers have done. So really this is on all of us to take our work beyond just, our collaborative projects, to really think through how can we use our different voices in our communities, with mothers you come across. Really, really use your voices and knowledge to spread the word that really we need to push our governments to do more.
I guess I would just say, from maybe it's just a different word, just different words from what Yudini just mentioned, is policy and mommy. I mean, we need to drive toward policy if we want to get to sustainability. At the end of the day, government regulates, whether it be public or private, and we need to get to policy to get to sustainability.
All day I've been listening for opportunities, opportunities where there might be more that we can do to be able to support you and your expertise and continue to support your work and continue to support our shared goals related to helping improve maternal health and strengthen the health system.
Today, I am 22. I understand that without tools, without care, we give death a free pass. As I look forward, I see for moms clearing gaps, fixing gaps, caring for moms. No more too late, no more packing bodies or whispering goodbyes. I recall my friend Aisha, beautiful, bold, she had a smile, that one that you could see from a distance, a strength, a light, I feel it. But like a battlefield she fought pain, pressure, preeclampsia, and still she's standing strong. A strength unveils that action to save mothers lies in her bloodline, in Project Aisha. So no woman should die while giving life. No mother should die while giving life. No mother should die while giving life.